gentle ladies. In our previous class, we discussed anatomy and physiology, overview of blood. And today, we are going to discuss on the assessment of clients on hematological disorder. In the assessment of clients with hematological disorder is a process of evaluating or assessing a client to know if the client is having hematological disease. Firstly, in assessing a patient, in assessing a client with hematological disorder, there is two great things that you need to do as a nurse or midwife. The first role you are to do is you are to do two datas. The two datas I'm referring to is of two types. We have subjective data and objective data. I will still take it again. I said if you are to assess a patient or a client with hematological disorder, you need to take note of these two items, two data. We have subjective data and objective data. If this is subjective data is a process of asking a client on how he or she feel about his health status. For example, we have to ask of the patient past health history, present medical history, nutritional history, the name of the patient, the elimination process or the excretion process, and you have to ask on the following symptoms. All these data, they are what make up subjective data, and so on and so forth. I will still take it again. I say subjective data is just like a process of assessing a client. In this particular role, you need to ask the patient how he or she is feeling, like the past medical history, the present medical history, his occupation, his sex, his gender, his nutritional status, his cultural status, and you also ask of the following symptoms, what the patient is feeling. And then if they said objective data is a process of assessing a patient, by doing physical examination. I said objective data is just like the process of assessing a patient by applying a physical examination. Now let's differentiate between the subjective data and objective data. In subjective data, you assess a patient from head to toe by asking different questions. But in objective data, you are to collect patient data by applying physical examination. This physical examination I'm referring to, you need to perform the following. You need to do the following: inspection, palpation, auscultation, and inspection. Those are the things that comprise or that made up physical examination. Now let's take it one after the other. The subjective data. There are some important health information you need to know regarding the subjective data, and which is as follows: the past medical history, the past medical history, the present medical history, patient nutritional metabolic pattern, elimination process, the activities or exercise. You also need to know more about the sleep pattern. Did the person used to sleep well or not? Cognitive perceptual pattern. You also need to know about that. And then the self-perception pattern, including surgery or other treatments. You need to know all about this role, and then the role relationship pattern, and then the sexuality reproductive pattern, and then the coping stress tolerance pattern. All these items, they are items that they are vital information that you need to ask when applying subjective data. I will still take it again. I said there are important health information that you need to know regarding if you are carrying out subjective data. And I said number one, the past health history, the present health history, the nutrition, the elimination process, the sleep pattern, the rest pattern, the activities, and then the cognitive perceptual pattern. All these items, they are things that you need to ask when carrying out subjective data. Like the past health history, you need to determine if the patient if the patient had a hematological problem. How will you know? Is by asking on the previous problem that relates to hematological. For example, you can ask the patient, have you had anemia before? Do you have anemia before? Do you have bleeding disorder? Have you come across blood disease such as leukemia and other things? If the patient responded that yes, he or she is having such problem, then what you just need to do, just get your record chart, then you record, then you record. Then the number 2 item now, you also need to ask about the patient nutritional status. How will you ask? You need to ask the patient, did he used to eat well? If she said yes, then don't just accept the yes alone. Ask the patient, do you used to eat protein food, iron foods? If she said yes, then you document. Because we have some people, some patients, that you see them, in the morning they will eat rice, in the afternoon they will take cassava, at night they will take yam. And all these things, they are items that fall, they are foods that belong to, that fall under carbohydrate. So now in this particular item, you need to advise such patient to be taking iron food. You need to take them to also iron food regularly. Then the next item is the elimination. You need to ask if blood has been noted in urine or stool. The blood I'm referring to here, you need to ask the patient if the patient normally is to pass urine with blood, hematological. If the patient said yes, he or she normally is to pass such, then you need to document you need to document. And you also need to tell them, you need to watch the input and output chart of the patient. What the patient normally is to take in, the amount of the water the patient needs to take in, and then the amount of water the patient is taking out. You need to watch those particular items. Then the next thing is what? Activities/exercise. You need to ask the patient the type of work the patient is doing. If the patient is like the type that used to engage himself in too much of work, then you need to advise him or her to reduce such activities. Then the next one is what? Sleep and rest. In this particular item, you need to ask the patient, do you have time to sleep? Do you sleep? How many hours? How many hours do you used to sleep? How many times do you sleep? Do you find it difficult in terms of sleeping? If the patient responds yes, then you need to take your records. Then the next thing is cognitive perceptual pattern. The cognitive. And this particular item, you need to watch the patient thoroughly. How will you watch the patient? You need to ask on the autoimmune disorder, such as rheumatoid arthritis, because it may caused by gut secondary, which may increase urine acid production as a result of hematological malignancy or hemolytic anemia. Then the last phase, you also need to act on the self perception. How do you feel? What is the problem? Tell the patient that each time she's having such problem, tell her to share it with eight persons. And the last one, you also need to know on the present medical history. The present medical history. So that is all regarding the. Then you also need to ask of the patient name, his address, his occupation, then the environmental. How did the person normally used to inhale like smoke, chemicals, like chemicals, and so on and so forth. So that is all regarding the subjective data. Now the objective data. In objective data, I told you you need to perform such procedure by asking the patient. In this particular phase, you don't even need to ask the patient. You need to provide a good environment, place patient on comfortable position, then you perform physical examination. The physical examination I'm referring to, number one, you need to do inspection. Inspection. The inspection I'm referring to, you need to assess from head to toe. And you need to assess, inspect. You need to inspect very well. Then the second phase is percussion. The percussion I'm referring to, the part affected, you need to ask the patient. Do you feel any pain here? Sometimes there may be tenderness. And if there is tenderness, it could be as a result of accumulation of blood in such particular area. Then you need to do, I say number one, inspection, percussion, then palpation. You need to do palpation. The palpation I'm referring to, you need to apply it on the patient body, one after the other. Then the last one is auscultation. The auscultation, you need to apply stethoscope on carrying out this particular examination. In carrying out this particular examination. In palpation, you need to check the patient heart and chest. You need to check the breathing, is it slow? You need to check on hepatomegaly. You need to check on splenomegaly, and then the extended abdomen, and then the weakness of the patient. And in the other phase, if you are carrying out, you need to check the patient's mouth, the ear, the nose, and whatever, one after the other. Is there any problem? If there is no, then you need to record all your findings. And then the other phase is what? If you are to inspect, you need to check the skin for lesion or color change. And if you are to auscultate, you need to check the patient BP. And if you are to palpate, Then you check the patient pulse for tachycardia. And then on objective data too, if you are about to do it, you need to check on the following too. The CBT, you need to ask the patient to undergo this laboratory diagnosis, like the CBT, the WBC counts, the HGB of the patient. You need to know them one after the other. And then in subjective data, you have to ask the patient on, did the patient normally used to pass black stool? Then, did the patient normally used to vomit? Then the blood, and then did the patient normally used to have dark color urine? And then is there fatigue? And then is there heart palpitation? So in carrying out all these items, you need to ask the patient on this particular item. Another one again, another item is another diagnosis, the CBC I'm referring to is complete blood count. In complete blood count, then you need to check on hemoglobin. You need to check on hematocrit, HCT, the total RBC count, the red cell index, then the RBC morphology. You also need to check on WBC counts, and you also need to check on WBC differential. And the last one, you also need to check on platelet counts. Now, in this hemoglobin I'm referring to, it helps in the measurement of gas carrying out capacity of the red blood cell. Of the what? Red blood cell. This hemoglobin I'm referring to, in females, is about 11.7 to 15.5 gram. Then, and in male, the normal range is about 13.2 to 17.3. And then in hematocrit, which is HCT, the measurement, it helps to measure the packed cell volume of RBC expressed as a percentage of the total blood volume. Now, if you want to check the total number, the average number, and the interval, the range of this hematocrit, in females is about 35% to 41%. And in male is about 39% to 50%. That is for the hematocrit. And then for the total RBC counts, that is for the number of circulating red blood cells. The range in females is about 3.8 to 5.1, and in male is about 4.3 to 5.7. Then for the red cell index is determination of the relative size of red blood cell. Now, what is the range of this red cell index? Is what? 80 to 100 FL. Now for the RBC morphology, the examination of the shape and size of red blood cell, and then the measurement of the total number of the red blood cell. Here, the number of these, there is no variation in red blood cell morphology. There is no what? Variation in red blood cell morphology. Now, in white blood, in WBC count, measurement of total number of WBC, the range is about 4,000 to 11,000. And then the other one is RBC differential. The RBC differential determine whether each kind of determine each kind of white blood cell is present in proper proportion. Absolute value of each type of white blood cell can be determined by multiplying the percentage of cell. The average range of WBC differential is, in neutrophil, the average range is 50% to 70%. And in eosinophil is about 0% to 4%. And in basophil is about 0% to 2%. And in monocyte, the range is about 4% to 8%. Now the platelet count, the number of platelets count is available to maintain the platelet clotting function, not measurement of quality of platelet function. And then the range of this platelet count is about 150,000 to 400,000 UL. Yes. Now, in preparing all these particular items, in this platelet, the normal average, I said, is 150,000 to 400,000 UL counts. And bleeding, and what? And bleeding may occur with thrombocytopenia. Spontaneously, hemorrhage is possible once platelet count fall below 10,000 UL. A more extensive description of clotting study is presented. What is this what is thrombocytosis? They say thrombocytosis is defined as excessive what? Excessive platelets. When there is excessive platelet, is what is referred to as what? Thrombocytosis. And is a disorder that occur with inflammation and some malignant disorder. The most likely complication related to thrombocytosis excessive is what? Excessive clotting. Ah, now in these particular items, you also need to check on bilirubin and then the blood smell, the comb test, the cobalamin, which is vitamin B12, the erythrocyte sedimentation rate, the erythropoiesis, the fibratin, the folic acid, the hemoglobin, electrophoresis, the homocysteine, the iron, the lactate, and also the microglobulin, and then the reticulocyte, and then the serum protein, and then the transferrin, and then the transferrin saturation. Now, if they say the bilirubin measure of degree of red blood cell hemolysis or liver inability to excrete normal quantity of bilirubin. Now, why do you carry out this bilirubin? It increase indirect bilirubin with hemolytic problem, and it increase indirect bilirubin with obstructive problem. Example, like gallstone, liver tumor, and etc. Then the second phase is what? The blood smell, peripheral blood smell. Now, you need to check the color, the size, the shape, and then the quantity of cell in peripheral blood. Then you also need to check on the comb test. On this comb test, you need to check on differentiation among the types of hemolytic anemia. And you also need to check on cobalamin, the level. You need to check the level of cobalamin available for production of new red blood cell. And then the normal range of this level of cobalamin is 200 to 835 pg per ml. And then you also need to check on erythrocyte sedimentation rate, which is ESR. That is, you also need to check on the measurement of sedimentation to check if there is inflammatory process that is caused by alteration in plasma protein that may result in aggregation of red blood cell and making them heavier, and then faster sedimentation rate, the higher what? ESR. Now, the normal range of this ESR is greater 30 mm. Then you also need to check on erythropoietin. The erythropoietin, you have to measure the degree of hormonal stimulation to bone marrow to stimulate the release of red blood cell. And then the normal range is 5 to 35 UL. And then you also need to check on ferritin. Ferritin is a major ion storage that help to store protein, that help to what? To store protein. And then the normal range is 3 to 16 NL. Then you also need to check on homocysteine. In male, the normal range of this homocysteine is 5.2 to 12.9, and in female is about 3.7 to 10.4 U mole per liter. Then you also need to check on the ion. In the ion, you also need to check on the serum ion and then the total ion binding capacity. And the range of this serum ion is 50 to 175 mcg per dl. And then for the total ion binding, the range is 250 to 425 mcg per dl. You also need to check on the LDH, which is what? Lactate dehydrogenase hormone. You need to check on intracellular enzymes that is present in almost all the body tissue level arises in response to cell damage, which may increase, it helps to increase the level confirmed diagnosis of injured or disease may be used as a non-specific marker of haematological malignancy growth and response to treatment. And then the normal range of this is 140 to 280 UL per liter. You also need to check on methyl malonolic acid, which is MMA. The indirect test for cobalamin, which helps to decrease the level of cobalamin deficiency, and it helps to differentiate cobalamin deficiency from folic acid deficiency. And the range is greater 0.2 U mole per liter. And you also need to check on microglobulin, which is also known as beta-2 microglobulin. Protein are found in this particular surface, which help to increase in patients with malignancy, such as lymphoma, leukemia, multiple myeloma, and which may be used as a tumor marker. In blood, the normal range is about 0.7 to 1.8 mcg per mole. And in urine is about less than 300 mcg per liter. And in spinal fluid is about less than 2.4 mg per liter. Then you also need to check on reticulocyte count. The reticulocyte count. And the normal range for it is 0.5% to 1.5%. And you also need to check on serum protein electrophoresis, which is SPEP, which help to separate protein in blood on basis of electric charge, which helps to dictate hyperglycemic states such as in multiple myeloma or some lymphoma. And the normal the normal binding pattern of globulin increase in any protein is abnormal. Then you also need to check on transferrin. The normal average of this transferrin is 190 to 380 mg per dl. You also need to check on transferrin saturation. It decreased in iron deficiency anemia and increased in hemolytic and megaloblastic anemia. And the range is about 15% to 50%. That is all regarding the phases I just mentioned. And then in objective data, you also need to check on arterial blood gases. You also need to check on chest X-ray. We have talked about the CBT before. The WBC differential, we have also talked about that. So in summary, I said if you are with a patient and you want to assess on hematological disorder, there are two major things you need to do, which is one, two great data you need to collect. Number one, I said subjective data. And number two, I said objective data. And I said, if they said subjective data, that means is a data that you do as a nurse or as a midwife that you need to ask the patient, you need to check the patient from 8 to 2. And you also need to ask the patient series of questions, different questions, like past medical history, present medical history, nutritional history, the stressing pattern, the coping pattern, and then the elimination pattern. All these, they are what you have to do in terms of the subjective data. And then you also need to play a role by checking the patient from 8 to 2. You need to check the patient head, the nose, the eyes, the whatever. Then, in physical examination, in physical data, that is the time. In physical data, in objective data. In objective data, that is the time you need to ask the patient, you need to perform this procedure called physical examination. And then in this physical examination, you need to ask the patient, you need to do the following. The You need to do the following. Uh, you need to do the following: the inspection, percussion, auscultation, and inspection. And there are other things that you need to also do. The diagnostic evaluation now. You need to check on the bilirubin, the blood smell, the clump test, the cobalamin, the CBT, the erythrocyte sedimentation, the erythropoietin, the ferritin, the folic acid hemoglobin, the homocysteine, the lactate, LDH, the microglobulin, the reticulocyte count, the white blood cell count, the transferrin, the serum protein, and then the transferrin saturation. All these particular items, they are what you are to ask the patient to do. And then you also need to check on the hemoglobin, the hematocrit, the total RBC count, the red blood cell index, the RBC morphology, and then the WBC count, and then the WBC differential. Ladies and gentle ladies, we'll stop for today. This will be the end of our lecture for today. We'll continue from our next class if God spare our life. Thank you and God bless.